Good afternoon and welcome to our weekly COVID-19 public health update with Montgomery County Executive Marc Elrich. I'm Lorna Virgili, Hispanic Public Information Officer, and joining us today is Dr. Travis Gales, our Health Officer, and also Dr. Earl Stoddard, who is the Acting Assistant Chief Administrative Officer. Reporters, all of you should have permission to record. If you do not, use the chat to request it. And with that, to you, Mr. County Executive, good afternoon.
So good afternoon, everyone, and thank you for joining for the weekly press briefing. I'm going to start not typically as I do on COVID, but with today's tragic events regarding fatal flooding issues that have occurred at the Rock Creek Woods Apartments in Rockville. Currently, there's one fatality and one unaccounted for individual, with approximately 150 people from 60 apartments who are going to be displaced. I went over there as soon as I could this morning, and in my 60 years of living in this county, I've never seen anything like this. Reports and videos of powerful flows of water immediately flooding basement apartments in the middle of the night is shocking. This happened sometime between 3 and 4 in the morning. People were sleeping, and at the ground level, they may not have even realized they were being flooded until the waters started rising inside their apartments. It's really a scene that you would have expected to see in hurricane country that we've just experienced, but not here. We're bringing all the resources we need to help us understand what happened and how to correct it. We know we've had multiple major rain events that did not create flooding at this scale, and we're very unlikely to see more of those events. The hurricane season is far from over, and we need to find and fix whatever problem created this sad and tragic event. It really is true that we've had major storms that have dumped comparable sizes of rain here, and this area did not flood. So we have to look very quickly and very carefully to see what the source of this was. Why is this different than the other events, and what can we do to make sure it does not happen again? In the meantime, we're also taking care of another 20 units of residents that were displaced at Congressional Towers, again, by flooding. Not exactly what we expected. We have our culturally competent support services are at Montgomery Mid-County Rec Center on hand to help these families out. This facility is going to be open until 10 p.m. at a minimum, but we're willing to keep this open overnight and as long as needed, as we seek to find places to help them get into stable housing while the units are being repaired and services like electric restored to the building. I want to send my sympathies and condolences to the families who lost their loved one, and want all the impacted residents to know that we're here to help, and we will be with them throughout this difficult ordeal. I also want to thank our Fire and Rescue Services, Emergency Management, Police Department, and the Transportation Department for their quick response to this in the middle of the night to help these people out as quickly as possible. And amidst all of this, we're expecting more heavy rains today from the remnants of the hurricane, and our school system has chosen to close this afternoon as a result of the weather forecast. So we know we're in for more water, and it's important that we make sure we get people moved to safety and to get as many of their belongings out. When I was there, the first family was going into their unit and getting things they needed out of the unit. So it's important we're able to do this quickly. Our Emergency Operations Center is open and activated, and Dr. Stoddard is on our call today to give more detailed updates on the weather forecast and the county emergency operations and responses. This tragedy in our weather today is a reminder that we all need to prepare for natural disasters to occur and have a preparedness kit ready. Talk to your family about how they can safely exit your home, and always be mindful and alert of weather conditions. And if you're not getting weather alerts on your phone, please sign up for the county alerts on our website. If you can afford to do so, please donate your time and resources or money to the Red Cross and other charities who assist our communities during these disasters. The Red Cross was on this scene this morning as well. The deadly weather we're witnessing today is remnants of the hurricane, like I said, we're in the middle of the season, so this is not the last hurricane that we're likely to see. Our fire and rescue department deployed 45 team members with 23 different pieces of equipment, including 8 boats, to assist the residents of Louisiana. And I'm really grateful that we were able to do that and still put a strong functioning team on the ground when we needed it in Montgomery County. I want to thank them for going to Louisiana and for their work this morning. And as for the COVID update this week, this is where we stand. Today, our positivity rate is 3.51%, and our case rate is 15.04 per 100,000. We had 141 new cases yesterday, so this is in the range of what's become more or less typical. Remember, most of those cases are among people who are unvaccinated. This week, our 7-day community transmission has gone from substantial to high, according to the CDC. And you can see that on the map there. So we join most of the other jurisdictions in Maryland in being in the high rate of transmission. We're at the low range of the high rate, but there's little consolation in that. It's still a lot of people getting sick who frankly don't need to be getting sick. If people were vaccinated, this would not be happening. Like the rest of the country, our numbers are going in the wrong direction. And the spread of this is clearly a result of those who refuse to get vaccinated. I know they like to talk about vaccinated people getting sick, but at the beginning of the line of exposure of any vaccinated person getting sick is they're getting it from somebody else who was unvaccinated. This starts with the unvaccinated. And if we didn't have unvaccinated people, we would not be experiencing this. So we need to be clear about, who's responsible for this and what the consequences are. And a lot of people are getting sick who don't need to be sick. And some people are going to die who don't need to die. And it's kind of tragic in this day and age that this is still going on. So I hope at some point people who haven't been vaccinated wake up and realize this is something they need to do, not just for themselves, if that doesn't matter to them, but think about the people around them. We're going to do everything we can to minimize this. I will say this week, the European Union recommended that its 27 nations reinstate restrictions on tourists from the United States because of rising coronavirus infections here. And I hope everybody ponders that. We are the most industrialized, modernized country in pretty much in the Western world and in the world. And we lead in things like deaths happening here. We should be the last place on earth to be in this situation, not the first place on earth to be in this situation. So we need a more serious approach from people in this community who are reluctant to do so, to make sure that they take everybody's health and well-being into account. Our vaccination rates are really strong. Our hospitalizations and deaths remain lower than they were when we had similarly high rates before the vaccine. So that's something to be thankful for, and it clearly demonstrates that the vaccine works, and the studies that keep coming out confirm that vaccinated people are getting lesser versions of COVID. We continue to have the highest vaccination rate for all jurisdictions with more than 300,000 people, and this is what's helping keep our hospitalization rates low. 73.3% of our total population are fully vaccinated. That's 20% higher than the national average. And when we say total population, this means everybody under 12 who can't be vaccinated is included in that total. 86.4% of the eligible population is fully vaccinated, which is 25% higher than the national average, and 94.6% of our 65 and older population is fully vaccinated, and that's 13% higher than the national average. This week, our total population receiving at least one dose went over 80%, and our eligible population receiving one dose has reached an astounding 95.2%. So most of you are doing a wonderful job in getting yourselves vaccinated and looking after the people that you care about. And I want to thank you for that, because our numbers would be a lot worse if you all hadn't done this. And it's a shame that some people will get sick even after getting vaccinated. But again, that's not necessary. But it does lead to the next thing I want to talk about, which is vaccination passports. It's clear to me that if we're going to avoid these cases and continue to avoid watching this spin out of control like it did last fall and winter, we have to vaccinate. We have to implement a vaccine passport program. When cases are higher, there's more anxiety about exposure. This hurts businesses who already have had a miserable 18 months. And I know, and I said this last week, I'm going to say it again. When I go out and I see people in restaurants aren't even close to capacity. When I talk to people about going out to dinner, so many people I know will not go to indoor dining, and the reason they give it is that they don't know who's sitting next to them. Vaccine passports would give customers the assurance that if you go into a restaurant, the person sitting in that same room with you is either vaccinated or has a negative test that was done in the last 72 hours. With the high level of people that we've got vaccinated, when you've got, 94% of your 65 plus population vaccinated and 95% of people over 12 receiving one dose, vaccine passports aren't going to keep customers away. What they may do is tell more customers to come to your restaurant, because they'll know with a vaccine passport that the people who could infect them aren't going to be in the restaurant. And so I'm encouraging this voluntarily. We've got a bunch of restaurants that are moving that direction, and we're also going to suggest that the council consider doing it. When, in the earlier days when we were trying to do everything with everybody else, the goal was that if we did something here that nobody else did, people would just go to the other jurisdictions. So if I was more restrictive, people were worried that they'd go to a less restrictive place. By allowing us to maintain our capacity and our ability to serve people, we actually could become the destination to go to. If people have a confidence level that dining in Montgomery County, being in Montgomery County is safer than it is in other places, we may actually see more customers rather than fewer customers. And so that's why you're going to be hearing more about this, and I would defer to Dr. Gales for more comments on that. I want to spend a few minutes talking about the issue around homelessness in our rec center. There's been recently a lot of discussion in the community about our decision to use Long Branch and Cofield rec centers as temporary homeless shelters. During the pandemic, when this was starting and it was spreading and we had no vaccines, no treatments, no masks, none of that stuff, we were urged to take immediate action to make sure homeless people were off the streets and put into living spaces where they could practice social distancing so we could minimize the spread of COVID. As vaccines came on board, these became extra important because it enabled us to work with the homeless population, which, if they were living homelessly, sometimes in the woods, sometimes in the alleys, and basically inaccessible to medicine, these folks would have been prime candidates for not only getting it, but not being vaccinated would have made them one of the most vulnerable populations in the county. And we made a decision to protect human life, and a decision that the homeless providers wanted us to do, which was provide shelter for people. And we did that. And I'm not going to apologize for doing that. Yes, taking away rec centers is a great inconvenience. Dying from COVID is a bigger inconvenience. And I wanted to make sure that we did not expose people unnecessarily. Traditionally, our shelter capacity decreases drastically from April to November. Basically, we don't shelter the homeless for 8 months a year. And this has kind of changed the dynamic because people actually got sheltered. But our surge capacity, where we sheltered people traditionally from November, till March, or through March, that capacity could not have held the same number of people. Because if you've ever been in our shelters, and I have, what you'll see is people sleeping on cots or on mats on the floor, literally next to each other, with their belongings clutched, under their heads as pillows. That would never have passed CDC guidelines. It would have been completely unsafe. So we didn't even have the traditional capacity we would have had in normal events to house homeless people. So we made an emergency decision to use the rec centers, and that is the right decision. I've heard people say, well, what's the long-term plan? We actually have a long-term plan. We're investing $15 million in a facility that'll house 200 people. It'll give us the capacity not to have to go through this again. And frankly, because this is what I want to see happen, put us in a situation where we don't put people out on the street for more than half the year. So it's a long-term solution for a long-term problem, and it's a short-term solution for this. Unfortunately, buildings that were resident ready don't exist. And we've been spending this money buying and modifying a commercial building so that we can make sure we can house people appropriately with the right showers and with all the right things they need there. We've heard two kinds of complaints about this. One is the Cofield Center has mice, mold, and leaks. So after hearing these reports, I went over to Cofield and I went there unannounced. I didn't want anybody to know I was coming there. And sure enough, when I showed up at the door, they had no idea who I was. They wanted to see my ID. That's all good. I'm glad they did that. But I was able to go in and walk around and look at the conditions in the building. And, you know, this is what I saw. I asked about a leak, and they said, yes, they had a leak. They had a leak during one of the major rainstorms we had, and it spiked the leak in the ceiling. And that's hardly unusual in the climate of these rainstorms where roofs don't spring leaks. This one sprung a leak. That leak had been fixed. And you could see the water stains from where the leak was that was not present throughout the building. I asked them to show me the mold. So I went to the shower rooms. And in the shower rooms, the showers definitely had been treated for mold. But people have to understand, if you're running showers 24/7 and you're getting hot, steamy water in a shower 24/7, you are creating the conditions for mold unendingly without being able to have those showers dry out and the ability to, you know, wipe them down and everything. They were very susceptible to mold, but mold was not present throughout the rest of the facility. It was pretty much confined to the bathrooms with the showers in them. And the mice, they definitely, you know, had mice. They are trapping for mice. We have brought in rodent control to make sure that we're doing the right thing. They've gone around the outside of the building and, you know, cemented up every hole they could possibly find. But they've been working at it. And when I asked the staff when they reported things, what happened, and they said when they reported stuff, that the county had responded and was able to deal with it. But this is an ongoing issue. You've got 60 people inside a building. Many of them bring food inside the building, not just in the kitchen areas. But if you went to the kitchen areas, you'd find all the food that's in boxes was in plastic containers so that rodents couldn't find it and chew through it. So while it's hardly an ideal living situation, and while they do have problems, it did not quite comport with the description that some people have made of the facility. But, you know, it is what it is, and hopefully we'll have a long-term solution so you don't have to deal with this. But I frankly, I expected to see worse than I did, given what had been reported. And, you know, I went in there, I'll be going back in there to make sure that it wasn't a one-off visit on my, you know, I happened to arrive at the right time on the right day to make sure that we can deal with this. There are other complaints around rec programs that was largely around Long Branch, but not exclusively. And our rec department is stepping up the provision of programs for the youth there to make sure that they have more things to do. These are terrible choices you have to make. Nobody makes this choice lightly. We didn't know how fast we'd come out of the pandemic, which made it very hard to plan for when we'd be open for other things. We do have about 70 people that are in hotels right now, but they're people who have severely health compromised or over the age of 62. We've had hotels that just won't take people anymore. One hotel I was told us that because a resident had died there of COVID, that their insurance company said they would discontinue their insurance if they continued to accept our patients or our clients. So it is not as easy as people think, particularly once hotels started getting regular tenants back in them. There's more of a reluctance to have a homeless population. When the homeless were the only people going into hotels, they were more open to taking any clients they could get. So we're going to continue to work at this. We will not let this linger. We will have a long-term solution. I'm really, you know, glad to say that we made the initiative and made that decision that we were going to solve a long-term problem. and do it in the middle of all this. I just wish the building could have been renovated faster. I just want to point out who our homeless population is. 60% of the homeless in Montgomery County are Black. That's a real number. When this originally came up and people wanted people removed from the shelter, and we didn't have places to put them, I was very clear I was not going to put people back on the street. And, you know, there's no way that I was going to put people on the street in August. So if people are mad at me for doing that, you can be mad at me for doing that. I've got to live in my own skin and with my own comfort level, and I feel we made the right decision. During the pandemic, 712 households experiencing homelessness were placed in permanent supportive housing in 2020 and 2021. And so we were able to get the large majority of people into permanent supportive housing. And homelessness among families decreased by 50%, and unsheltered homelessness decreased by 34%. So we were able to move the needle even in the middle of all this. Out of nearly 1,600 county residents that we lost in COVID, only 2 were homeless. You won't find this number in other places. So I'm proud of the efforts we've made to protect the homeless. I'm thankful for the quick reaction of HHS and DGS teams to quickly address the issues. I want to assure people that we will continue to monitor them, and I will do this personally to make sure that things as they occur are addressed as they occur in real time. And as soon as we have the ability to provide reasonable, safe, secure, and adequately distanced facilities for people, we will continue to move homelessness into other situations. So I'll stop there for today and turn it over to, I guess, Dr. Gales and Dr. Stoddard.
All right, Dr. Gales, would it be you next?
Good afternoon, everyone. I don't have a lot to add to what the county executive mentioned. He referenced our COVID numbers, and he is correct. We have, because of our case rate is now over 15, we are now classified in the high risk of transmission category per CDC. And as he mentioned, because of that, we obviously continue to monitor trends. Fortunately, we've not seen a comparable or a more significant uptick in hospitalizations consistent to where we were in the fall, which is a positive sign, again, in large part due to our strong numbers in terms of the percentage of our population vaccinated. This continues to take on added significance and importance as our children are going back to school. And we want to obviously keep them safe, particularly those who are not able to get vaccinated due to their age. And so as he referenced, you know, as we look to other mechanisms we can put into place to mitigate transmission, certainly we have looked at other jurisdictions and other countries to see what strategies they put in to, one, encourage individuals to get vaccinated, as well as mitigate vaccination. And one of those strategies that he referenced is the concept of a vaccine passport. And from a public health perspective, that is something that we would feel comfortable recommending and supporting because, one, it helps to keep environments safe. It takes away, if you will, some of the, and I hate to use this word, but takes away some of the penalty from those of us who are vaccinated in terms of being able to participate in different activities. And it avoids potentially having to put in restrictions around capacity limits and things like that. So we look forward to continuing those conversations and exploring those options to put that forward as an option for our residents within our county. And the second thing that I would mention, we continue to offer testing sites and vaccine sites. As we talked about last week, we began providing vaccination third doses for our immunocompromised community. And we are continuing to await further guidance around booster shots being made available to the general public, most likely based upon a time frame from within which one received their first 2 doses. Condolences to the families influenced by the overnight flood. And from a health perspective, just want to encourage folks to be safe as we are expecting a large rainfall in the next 24 hours. So continue to practice safe practices, not only for COVID, but also when navigating the high rainfalls and so forth and interacting with your families. Thank you, and happy to answer any questions you all may have.
Thank you, Dr. Gales. Dr. Stoddard.
Good afternoon, everyone. I'm just going to highlight a few things the county executive said, added a little bit of context. I'll start off with the weather-related things for today. As county executive alluded to, the Emergency Operations Center will be partially activated. What that means is that we'll have people in the space monitoring the weather conditions, the roadway conditions, monitoring the calls for service that come into our 911 center to make sure that we're staying on top of and providing the coordination necessary for our response to the remnants of Ida, now Tropical Depression Ida, moving through the region over the next 12 hours or so. We're expecting about 2 to 4 more inches of rain in Montgomery County. But I think when we often talk about 2 to 4 inches, that's not an enormous number, but the problem often becomes you get localized spots where you get substantially more rainfall in a much more compressed time frame, and you get flooding instances like we saw late last night, I guess early this morning. As kind of executive alluded to, we are taking a look at the land proximate to the apartment buildings that were impacted today to assess exactly what the cause of this particular incident was. It clearly was a tremendous level of rainfall. We have National Weather Service reporting of 3.3 inches over about a 60-minute period. And we have train spotter information that suggested there was about 2.4 inches over about a 34-minute period. Those are intense levels of rainfall over very short periods of time. But we want to make sure, identify any additional causative factors or, influencing factors, like whether there were any stormwater management issues or whether the creek bed was properly maintained in the areas around that property. And so that's all part of things that we're going to be taking a look at. The Mid-County Recreation Center is open as a reception center. We will take people in, as county executive alluded to. It's going to be open guaranteed till 10 p.m. So if people went to work this morning and didn't make themselves known to the Red Cross or Health and Human Services, they could still do that through 10 o'clock tonight. What will happen at 10 o'clock tonight is largely dependent on, do we have a need for an emergency sheltering? If there's a small number of people who are displaced, other people may have places they want to go stay with friends or relatives that they're more comfortable with. Then may hotel a small number of people. If there's a large number of people that are displaced, we will open a shelter for the night and for as long as necessary to keep those people housed. We are going to be there to support them. And as county executive said, we will be providing culturally appropriate communication and services to the residents. We've also had outreach from the Mexican consulate, because they're aware of some Mexican nationals who do live in that apartment complex. And so they offered their important services, and we appreciate that. And so we'll be looking to make sure that those services are availed to the residents who were impacted. As both Dr. Gales and the county executive said, thoughts and prayers go out to the families of those who were affected, particularly the family of the young person who did lose their life in this incident. The last thing I will note, and it's on the COVID front, is that we began our validation process for employees to assess their vaccination status last week. We launched that on Friday. We created a system where people could go in and report and provide documentation of their vaccine status. In total, we have about 12,000, a little over 12,000 county employees as part of this documentation process. We've heard from about 2,600, which is 21% of those responded so far. We've asked them to do it over the next 2 weeks to provide their vaccination status, and we'll be able to provide information on what the numbers come back for those who report, and that will dictate how the corresponding testing program will work moving forward. So I will stop there, and I think we're happy to entertain questions.
Thank you, Dr. Statter. Thank you, gentlemen. First questions coming from Caitlin Peets, Bethesda Beat, and they are for the county executive. Caitlin, good afternoon.
Good afternoon. Thank you. I suppose this question could either be answered by Marc or Dr. Stoddard, whoever wants to weigh in. I know that you said you're kind of looking into still what happened early this morning in Rothville. Is there anything that you can share that you've learned so far, or a timeline for when you might be able to tell people what happened here?
Yeah, I'll start. So we took a preliminary. So first off, the property that directly abuts the apartment complex is actually it's actually within the municipal jurisdiction of the city of Rockville. There is a creek there that does have a small bend and goes into a culvert that goes underneath the apartment complex right at the corner where most of the flooding occurred. And so we have taken a look at the culvert, and there's no clear blockages in the culvert itself. And there is pretty clear evidence at that culvert that it was overtopped last night and did flow through overtop onto the neighboring roadway and into the what is essentially a basin where these two apartment buildings reside. And so there is definitely indication that this is a significantly driven by the amount of water that did come down in a very short period of time over the early morning hours of this morning. But we're doing a more thorough investigation, looking, going through the whole culvert, making sure that there's no blockage further down the essentially what is a pipe between the creek as it is above ground and when it comes out on the other side of the apartment complex, essentially runs underneath the apartment complex. It clearly looks like it overtopped based on the debris pattern above the stream, but we need to understand, was it overtopped exclusively because of the volume of water, or was it overtopped based on both the volume of water as well as any sort of, if there was an obstruction or not. And that's what we're trying to understand, is whether there's any obstruction. There's no evidence that there is right now, but we are just getting into this right now.
And to be clear, who is leading that investigation into all of this?
So it will be a joint effort between both the county, as directed by the county executive, as well as the city of Rockville, because obviously the property upstream, I guess as you would describe it, of the property of the apartment complex is managed and maintained by the city of Rockville. But obviously the culvert underneath the property is county property, and therefore we have to look at both. And so we'll be working jointly with the city of Rockville. We've already had city of Rockville officials on site today, taking a look, because obviously we're concerned about, we're going to get more rainfall this afternoon. We don't want this to become a, if there's something immediately observable, we would want to address it today. And so we'll be working jointly with them as well.
And one final question. To your knowledge, has there previously been complaints or concerns about the related conditions at this apartment complex?
I was on scene at about 5 a.m. this morning and working very closely with both the property owner as well as the property management company. And they have no history of this having occurred in their, even no reports of minor in-apartment flooding. The ground does get wet. It is a basin there, but there certainly has been no history of this having occurred, anything like this having occurred in that space before, according to the property, the maintenance facility manager.
Thank you.
Thank you, Caitlin. Rebecca Tan, Washington Post. Questions for you, Dr. Gales. Good afternoon, Rebecca.
Good afternoon. So this concept of a vaccine passport, can you just clarify who would be in charge of that in Montgomery County? Would that be a Board of Health decision? How would that happen?
Thank you, Rebecca, for your question. I think there's some details that would have to be worked out, and I think as with any of our public health regulations, it is done in concert with the county council's Board of Health and the county executive. So, from as far as, and I know there are others who could probably answer and provide more details, including our legal and legislative team. But I suspect that it would be something done as, again, consistent with all of our previous resolutions and efforts in partnership with the county executive and the county council.
Got it. And just so I understand, have you made a formal recommendation to the Board of Health yet that they do this, or is this still sort of in the works?
Still in the works. There's no formal recommendation, but certainly I did send a formal notice to the council sitting as Board of Health to notify them that we had the status as defined by the CDC had changed. That was sent this morning, and so naturally, as part of that, as we've been hopefully been consistent and transparent throughout the pandemic, is that we continue to think through strategies and ideas to mitigate transmission as numbers may change here and there. So it's something that has been preliminarily discussed, but given the situation where we stand now, where the numbers are, I'm confident that those conversations will move forward in a more substantial way.
Thank you. Really appreciate that.
Thank you, Rebecca. Next, Dominique Maria Bonesi from WAMU. And Dominique has questions for you, Mr. County Executive and or Dr. Stoddard. Good afternoon, Dominique.
Thank you, Lorna. Good afternoon. I had one question regarding the flooding. I think when I think about serious flooding in Maryland, I often go to the flooding that took place in Ellicott City just a few years ago. And I wonder if, given climate change, given everything we're seeing in these past few years, and not just in Maryland, but in other states, County Executive or Dr. Stoddard, does this concern you that, this could just be sort of a red herring for other possible flooding in the future?
From my perspective, I think this is real. We get more complaints now from neighborhoods that never had flooding, that now they're experiencing flooding, that some of the rain events overreach the capacity of existing stormwater infrastructure. My administration had put in the budget a position to hire hydrologists. Unfortunately, it didn't make it through the budget the first year. But we are very concerned about this. We know that there are going to be more weather events. It looks like so far, we're running on the wet side of climate change rather than the dry side of climate change. But I think this is very real. I live on Sligo Creek Parkway, and I have seen that road underwater more times in the last year than I've ever seen it underwater in a short period of time. So I see it in my neighborhood. I hear it from people around the county. So I think it's real. And we're going to have to look at what it means for the infrastructure in terms of the size of pipes we use to carry stormwater away. If they're not big enough, it's going to result in greater flooding.
Just to add, I think that I don't think there's any question. I don't think I worry about it being a precursor. I think it is. I think it's clearly a precursor, not even a precursor, but it's an early indicator of what we have to face moving forward. Obviously, even when I was the director of the Office of Emergency Management and Homeland Security, we were sure to include climate adaptation as part of the county executive's climate action plan, because we knew that even if we took the aggressive steps needed to, abate climate change, the change has already begun, and it will take years to undo the damage that has been done to the environment, even if we're successful in doing all these things to mitigate the impacts. And so we know that we're on the leading edge of some of the concerns, and obviously other parts of the country, the Colorado River is facing huge reductions. The wildfires in California, there are clear signs and symptoms of climate change across the country. And in our area, it has often manifested itself as increased flash flooding events, not often necessarily associated with our streams and rivers, but sometimes it's just a matter of the built environment was not built for the level of rain intensity, wind intensity, and other things that we're clearly seeing more of. And so obviously, as county executive said, we're hopeful that that the Congress can act and we can see this infrastructure package get passed and have the opportunity to leverage those funds, among others, to improve the infrastructure to account for climate change and just the realities of the way the built environment has developed over time.
Thank you.
Thank you, Dominique. Next, Kate Ryan, WTOP, questions for the county executive and also for you, Dr. Gales. Good afternoon, Kate.
Thank you so much. I appreciate it, Lorna. So, Dr. Gales, I wanted to piggyback on Rebecca's questions about the proposal of a vaccine passport. Again, do I have it correct that you have recommended to the council that they call for one as the Board of Health? And are you in touch with other counties, other jurisdictions? Is it one of those things, hey, if many of us in the region do it, we all benefit because it becomes sort of the expected thing? And then for county executive, I'd love your take on what do restaurants say? Would they welcome the idea to make people feel more comfortable about coming in? So if I can start with Dr. Gales.
Thank you, Kate, for your question. So you don't have it correct. I have not made any recommendations to council as a Board of Health about this. The county is something that, has preliminarily been discussed. And, as part of our guidance, throwing out different ideas, recognizing that we are now at a different level of transmission as defined by CDC as a potential option. It's our stance that this would be more beneficial in terms of an added layer of protection and mitigating measures, as opposed to implementing, capacity limits and things like that. That would be the suggestion. There has not been a formal recommendation. The only formal communication that has transpired is, as I mentioned this morning, as part of our working relationship with the council as Board of Health and consistent with those previous resolutions, is that now that we have been identified at a different category, I have notified them formally of that change as of this morning. And so, yes, there have been, and the county executive can talk more about this, but I think there have been, more conversations around the region to discuss this type of policy and protocol, recognizing again that it always is more beneficial when we move together in terms of being able to have a greater impact. But in terms of formal conversations and discussions to discuss and hammer out specifics of such a platform, they have not formally commenced. But again, recognizing where we are and anticipating, questions to say, well, since the number has changed, what will we put forward? Here are just some recommendations and suggestions from the public health team, and we look forward to engaging the county executive as well as the county council in more in-depth conversations related to those proposals.
Thank you. And county executive?
So I'll actually be on a call with other county executives this afternoon. I'm going to tell them what we're thinking about. I think it makes sense if you're trying to keep as much open as possible and maintain people's confidence that they can do things. Unlike previous things we did that restricted what people could do, this actually would encourage people to do more things. And I think it would be good for business. I know there are restaurants that have already taken this step. I think somebody told me the US Open just made a similar decision that people would have to be vaccinated or have proof of testing. And that's an outdoor event. So I think, people are realizing that the only thing to control this is to make it more difficult for the uninfected or the unvaccinated to come in contact with people who are vaccinated or even with other people who are unvaccinated. So this is one of those things that you could actually make a difference in if you acted on it.
Got it. Last question, real quick. Is there any push to get student athletes required vaccinations? I've seen it in Fairfax County and Loudoun County. I'm unaware of it in counties in Maryland so far. Dr. Gales, Dr. Stoddard, anything on that?
I know it's being discussed within MCPS. That would be obviously within their spectrum to determine. Obviously, we generally support any mechanism to get more people vaccinated, but that is certainly within their spectrum. And I frankly know that they've discussed it. I don't know if they've made a determination, and obviously that would have to go to the Board of Education for their ultimate decision on whether to do it or not.
Terrific. Thank you very much.
Thank you, Kate. We have another set of questions. Jordan Lindsay, my MCM. Good afternoon, Jordan.
Good afternoon, Lorna, and thank you so much, everyone. I just wanted you to elaborate, Dr. Stoddard, if you can, on any other specific areas in the county that might be prone to flooding that residents should be aware of.
So that I think the part of the issue is that we have the areas of county that are prone to flooding, where flooding is just more regular. The issue is that the areas where we're seeing flooding are not the areas where you're traditionally seeing flooding. It's that we're seeing flooding in atypical areas. And I think that's the most problematic. Most people say, oh, I'm not in the floodplain. Well, the FEMA floodplain is really a narrow definition of where you should be concerned about flooding, particularly when the floodplains are often based on historic modeling of where floods have occurred in the past. And so the flood today happened in an area that has not flooded in this way before. and everyone's like, well, what's caused this? And there may be a partial cause, but then what's causing this largely is a significantly larger amount of rainfall than has traditionally been felt in that area because of the effects of climate change and just the natural deviations that may occur therein. That's, climate change doesn't always mean you're going to get more rainfall in a particular area constantly. It's just going to be more ebbs and flows more regularly in how we deal with these things. And so I don't know that I have a list. We've certainly looked across the county, and we are certainly seeing flooding in places that we have not typically seen it. We're actually seeing flooding in some cases in places that are being newly built out because their design specs are already being pushed to the limit by the amount of rainfall that we're experiencing. And so we're certainly, as part of the climate action plan process, I know our new climate coordinator, Adrienne Hochberg, will be focusing a lot on this. She was on scene this morning. We were having conversations about this. I know that we're going to be taking a much harder look at, the data that was provided to us through the climate action plan process will inform us. But as the county executive said, we're going to be looking to bring in a hydrologist to really improve the county's subject matter expertise in this area, because we know that it's not going to be flooding that is occurring in traditional places. It's going to be the flooding that occurs in the atypical places that's going to be the most shocking and potentially problematic.
Got it. Thank you very much.
Thank you, Jordan and Dr. Stoddard. I do not see any more requests for questions from members of the media. Reporters, going once, going twice. Okay, I guess we're done for today. Thank you, everybody, for participating and joining us. Stay safe, particularly today. We'll see you again soon. Take care.
Thank you all. Bye.